Respiratory measurement system. Assessment of the pulmonary function is primarily based on the measurements of the lung volumes, lung capacities, airflow, airway resistance, lung compliance and elasticity, intrathoracic and intra-alveolar pressures. Respiratory system. The function of the respiratory system is gas exchange. Three basic processes: ventilation, external respiration, internal respiration. Lungs. 2 lungs. Thoracic cavity. Right lung has 3 lobes, left lung has 2 lobes. Major blood vessels, nerves, lymph vessels and bronchi enter on medial surface of each lung at the hilus. Lung is covered by a serous membrane called the pleura. The visceral pleura covers the surface of the lung and the parietal pleura lines the inside of the chest wall. Pleural fluid lubricates the 2 pleural surfaces. Lungs. Lungs are elastic bags located in a closed cavity called the thoracic cavity. The right lung consists of the 3 lobes, upper, middle, lower. The left lung has 2 lobes, upper and lower. The surface of lungs is lined by a thin membrane pleura with a cavity. Inner surface lining the lungs called pulmonary pleura or visceral pleura. The part of pleural membrane lining the thoracic wall is called parietal pleura. Anatomy. Generally consists of upper and lower respiratory structures. Upper respiratory includes nasal passages, pharynx and associated structures. Lower respiratory includes larynx, trachea, bronchi, bronchioles, alveoli. Internal respiration. Gas exchange between blood and systemic capillaries and working tissue. O2 is high in the blood and low in the tissue, so O2 diffuses from blood into tissue. CO2 is low in the blood and high in the tissue, so CO2 diffuses from tissue to blood. External respiration. Gas exchange between the air in the lung and the blood in alveolar capillaries. O2 is high in the air and low in the blood, so O2 diffuses from air into blood. CO2 is low in the air and high in the blood, so CO2 diffuses from blood to the air. Ventilation. 2 processes: inspiration and expiration, inhalation and exhalation. Inspiration is an active process. Normal expiration is a passive process. Can have forced expiration. Who should be tested? All patients with dyspnea. All patients with chronic cough. Patients undergoing abdominal or thoracic surgery who are smokers or are obese. Workers exposed to noxious chemicals, dusts,